Hi everyone, my name is Andrea Sacasa and today I will be guiding you through the third course of the campaign Help Put Back the Missing Pieces. This video is brought to you by Alas. In order to start, we are going to have a little review on what is autism. Autism is a disorder characterized by challenges on social skills, repetitive behavior, speech, and nonverbal communication. Affects individuals of all races, ethnicities, and socioeconomic backgrounds. People with autism can often have exceptional abilities in visual skills, music, and academic skills. Also, it can be noticed by parents and doctors before the age of 3, and at the moment, there's no cure for autism. Will be dedicated to how can autism be diagnosed. We're going to start with developmental monitoring. Parents, grandparents, early childhood providers, and other caregivers can participate in developmental monitoring, which it is basically paying attention to how the child develops. They can use checklists of milestones which details behaviors and skills children should accomplish during every stage. Doctors and nurses will do developmental monitoring at each 12 visit. Lastly, a missed milestone can be assigned, but we should remember that everyone grows and develops at different rates. Some early signs could be if your baby or toddler doesn't make eye contact, such as looking at you when being fed or smiling when being smiled at, doesn't respond to his or her name or to the sound of a familiar voice, doesn't follow objects visually or follow your gestures when you point things out, doesn't point or wave goodbye, or uses other gestures to communicate. So doesn't make noises to get attention, doesn't initiate or respond to cuddling, or reaches out to be picked up, doesn't imitate your movements or facial expressions, and doesn't play with other people or shares interest in enjoyment. Additionally to the early signs, there are other signs that can be noticed at any age, such as loss of previous acquired speech, babbling, or social skills, avoidance of eye contact, persistent preference for solitude, difficulty understanding other people's feelings, delayed language development, persisting repetition of words or phrases, resistance to minor changes in routine and surroundings, restricted interest, repetitive behavior such as flapping, rocking, spinning, etc., and unusual and intense reactions to sounds, smells, tastes, textures, lights, and or colors. There are certain behaviors that the child should develop at certain ages. If not, these are called as red flags. By 6 months, no big smiles or other warmful and joyful expressions appear. By 9 months, there are no back and forth sharing of sounds, smiles, and other facial expressions. By 12 months, there is a lack of response to the name, no babbling or baby talking, and no back and forth gestures such as pointing, showing, reaching, or waving. By 16 months, there are no spoken words, and by 24 months, there are no meaningful two-word phrases that do not involve imitating or repeating. If the parent is concerned and has noticed certain signs, they can use MCHED, which stands for Modified Checklist for Autism in Toddlers. This is a psychological questionnaire that evaluates the risk for autism spectrum disorder in children ages 16 to 30 months. Many websites dedicated to ASD have developed online chats for parents to determine if the child requires professional evaluation. Nevertheless, it is important for parents to trust their own instincts and follow them, meaning that if the test shows that there is no risk for ASD, and the parent is still concerned, they should consult a professional. Professional diagnosis. Once parents have decided to get professional opinion, they visit experts such as psychologists, educators, and medical professionals. Medical diagnoses are mostly based on assessments of symptoms and diagnostic tests. It should be taken into consideration that there are no medical tests for diagnosing autism. In other words, there is no an exact assessment for ASD. Medical diagnosis. Most of the tests are based on observation of abilities such as communication, social interactions, and his or her activities and interests. The most frequent method used for ASD detection is made according to a Diagnostic Statistical Manual released in 2013 by the American Psychological Association. Many signs of autism are also common in other disorders, so medical tests can be performed to identify the cause or diagnosis. Educational diagnosis, also known as educational determination, is an evaluation of multiple disciplines in which parents and qualified professionals assess the possibility of special education for the child. According to the Individuals with Disabilities Education Act, children should be assessed in all areas related to a suspected disability, including but not limited to health, vision, hearing, communication abilities, motor skills, social and/or emotional status. Meaning that if professionals first come up with a possibility of a condition or certain conditions, and then they test according to their assumptions. All the links that were used and sources that were used in order to create this video. Thank you for your attention, and if you have any questions, please leave them in the chat box.